The current guidelines from the AAOS are not supportive of the use of glucosamine and chondroitin sulfate for joint health. But really the reason we're here today, they are 6 years old. And the nice thing is there's new and compelling data supporting the use of very high quality glucosamine and chondroitin sulfate products for the support of joint health. A lot of folks actually use these, for example, if they have joint discomfort, or if, for example, maybe they have like a creaky or achy joints, decreased flexibility. So for the most part, it's a supplement that helps them along with other recommendations. For example, good dietary habits, a healthy weight if they can maintain that as well. So it's part of the whole package, something that's there as a supplement to an overall healthy lifestyle. So what's different now compared to the last time, and I believe it was 2009 when they last met, is there's been three very interesting studies that have come out using either our product directly or the raw ingredients that's found in our product. The first study that I wanted to highlight was a study called the MOVE study, and the main take-home point of that study was it compared directly glucosamine chondroitin sulfate, very high quality pharmaceutical grade, versus celecoxib or Celebrex. And what they found is that they were completely equivalent. Celebrex is a pharmaceutical, prescription brand product, and this was compared to, again, a high quality supplement with completely the same outcomes. And that was looking at decreased pain overall and also decreased joint swelling. It was no small study by any means. It was 606 participants. The second study was actually even more than the study we just highlighted, and that was actually a study that came out of Brazil, and it was actually published the end of last year in the Annals of Rheumatology. This was one that compared Cosamin DS, which we manufacture, compared to a Brazilian pharmaceutical material. And again, similar to the MOVE study, it was the same efficacy was noted at the end of that 16-week study, and that was in pain relief and increased functionality. And the beauty of that study, too, is it was 909 participants. So both of those studies that we just highlighted are not small studies by any means. They're very large, and the data is very compelling, and why we think that now is the time to revisit those guidelines. In terms of the dosage recommendations that we're kind of seeking, the studies that we highlight today were actually based on a 1,500 milligram dosage of glucosamine hydrochloride and a 1,200 milligram dosage of the chondroitin sulfate. And again, that's found in our Cosamin DS product, and that was the first product that hit the shelves more than 2 decades ago. So it would be geared towards that particular dosage, which is backed by sound science and research.